Hello and welcome learners of Dr. B.R. Ambedkar Open University. Today we are going to talk about Introduction to Research. This is being offered to the first year students of MBA HHCM, that is meant for first semester students. This is also being given to the fourth block, that is Sampling and Research Methodology. And the unit is 11, Introduction to Research, falls under research meaning and processes. Let's get started. I want to start with a question. Did you know that every breakthrough in medicine or other sciences is largely because of the research? Do you even know that lots of medicine and pharmaceutical being tested as a product of research? So imagine if you could predict something like patient outcome before even the symptoms show up in the patient. How would that be? It would be totally different, isn't it? Then, what about research being used for other innovation? In fact, research is the key for all inventions, discoveries, and innovations today. Tell me a field of knowledge where research is not there. In fact, it's very difficult to find such topics. So what drives medical breakthroughs? There are a lot of factors. One of them is, of course, research. So let us look at from the perspective of the hospitals. Look at some hospitals. Some hospitals are in a position to provide better health care and also the treatment faster than the other hospitals. How is that possible? It's possible largely because of the research, because these hospitals are investing their time, effort, money in the research process. Similarly, research also turns every question into knowledge databases, which can further be used for the furthering of the knowledge. That's the beauty of research. So now look at how research has been able to unpack some of the important benefits of the healthcare facilities, and it will make the healthcare system more and more smarter. So let us dive deeply into what is research. What is research according to you? What do you think of research? Or what comes to your mind when you think of research? So research is very systematic process of collecting, analyzing, and interpreting the data and information. And why are we doing all these three things? We are trying to do it to solve the problems. The problems could be everywhere. The problems could be in healthcare administration. So in a way, most of the problems are being solved through research. Don't you think so? Yes, I'm sure that you will agree with me. Let's move on and look at in the healthcare perspective. So researchers try to help and improve the patient care. They're trying to give the best of their knowledge and abilities and expertise to the patient well-being. And they would also like to develop innovative methods of the treatments and enhance the overall ambience of the hospital management. And let me tell you, in fact, I would come with a caution that research is not just about data collection, but it's also a scientific inquiry. Inquiry of knowing things, inquiry of getting things done. Let's move on and look into the definition of research. Although there are plenty of other definitions, there are so many that some of them are quite generic in nature, some of them are like benevolent as well. But a research definition that has always been quite easy to understand is like this. So research is a systematic investigation or inquiry to establish facts and also to discover new information. With the facts, you are in a position to establish new information, and you don't stop there. You also try to apply the knowledge to solve the human problems, be it in healthcare, pharmaceuticals, innovation, technology, everywhere. So that's a basic definition of research. Let us look at the example, and I think the example will make it more easier for all of you to understand it. Like, you have studying the effect of the new drug on diabetes control. Wouldn't it be really fascinating to see how a new drug would be in a position to solve the problems of the diabetic patients? I'm sure this will help you a lot. Let us look at the importance of research, particularly in the healthcare area. Healthcare area is one area where research has actually grown in leaps and bounds. It actually allows and enables the evidence-based research. Basically, through the data collection, you're going to make a lot of decisions. These decisions are very important and also going to improve the overall patient care, and the outcomes are beneficial to the entire society. Let us look at the public health system, and research actually helps a lot of public health systems like vaccination program. Have you seen during the Pulse Polio campaign, millions of children were actually being helped from any kind of other vulnerable diseases? It's all because of the vaccination. And look at research on the COVID-19. COVID-19, when it actually struck us, and it also led to the development of the vaccination. It took a long time, but COVID-19 has actually helped many of us in understanding how vaccinations actually work. So many people took the shots of vaccination, and we could, in a position, save the lives of the people. Let us now look at what are the different types of research. As far as research is concerned, there are 3 different types, and the third one happens to be closely related to the clinical research. The first and the foremost thing is the basic research. As the word says, basic. When you say basic research, it purely enhances the fundamental knowledge of any given area. For example, you want to study the cell mechanism. That is a basic research. You want to probe, you want to inquire into the cell mechanism. The other one is the applied research. As the word applied, it means that application of research to solve the human problem, like it solves the specific problems. For example, developing diagnostic tests will enable you to understand the diseases better and the management of the patient care as well. The last and the third one in the category of the types of research is the clinical research. Clinical research precisely going to evaluate the new treatments done on the patients. Through these clinical trials, you will be in a position to know the outcomes of the patients. Now that we have learned about different types of research, it would be interesting to see the process of research, because research depends on the step-by-step process. So what is the step-by-step process? There are 7 basic steps. Some of the textbooks might also give you 6 steps, but it's all right to look at all the 7 steps. Let's look at one after the other. The first and the foremost step that you have is the identification of the problem. You have a problem. For every problem, you need a solution, but the solution comes only when you understand the problem and also trying to identify the problem. So the first step in the research is identification of the problem, like rising diabetes cases. India has now declared as the diabetes capital. Why is that so? This is a rising problem. This is the problem being identified by the medical fraternity. So that's step number 1. If you go a little further, the step number 2. The step number 2 is a literature review. What has been actually discovered earlier? What has been published earlier? What are the sources that were listed earlier? Or what is the existing body of knowledge as far as diabetes is concerned? Do we even know what has happened in the past? How old is diabetes in India? All these answers lie in the literature review or literature survey. Then comes the third step. And the third step is an important step because it actually allows you to formulate hypothesis. So what is a hypothesis? A hypothesis is generally an educated guess where you will like to know that how the variables are interrelated to each other. For example, new diet reduces the glucose level, isn't it? You would like to test this hypothesis. All the hypotheses would be tested. Then comes the fourth step. What is the fourth step? The fourth step is very simple. It is the research design, the design of the study. In the design, you will like to check what is the sampling technique that you are using, how did you collect the data, what are the true methods of data collection. All these are being entered into design study. Then comes the fifth step. This is the time where you're going to enter into collection of the data. How did you collect the data? Did you collect directly or did you collect it through surveys? Was that an online data? Or how did you manage to get the data by trials, by interviews? There are various methods of data collection. Each one of them is very important, and the purpose of the research will determine the data collection. Then comes the sixth step. The sixth step is nothing but analysis of the data. How are you going to analyze the data? Now that you collected ounces of the data, or you have lots of databases, it's time for you to look into the data and make some interpretation. This is where you're going to use the help of statistical methods like regression and others. Analyzing the data is the hallmark for any good research study. The last and the final step, once you analyze the data, you have interpreted, then you have to draw conclusions. The seventh step is to draw conclusions and also report it back. So these are the 7 steps of any good research process. I want to take you to a couple of case studies, especially as far as the hospitals are concerned. So let us look at the first case study. What is this case study about? The first objective is to look at the study effectiveness of new drug for diabetes. If a new drug is being introduced in the market, what is the effectiveness of this drug? So that is the first step. And if you look at how did we gather the method, random sampling of 500 students or 500 patients for that matter. So you have collected it from 500 patients and they were repeat. You have collected the data from 500 patients and you will like to know about the different stages of their development. So the outcome of taking this medicine, there is a 30% decrease in HbA1c after 6 months. That means the diabetes levels have come down 30%. Isn't it fantastic? How do you think that diabetes will get controlled through this new medicine being introduced? Well, the conclusion is drugs effectiveness in diabetes is able to control diabetes. That's the conclusion. Let's move on to the next case, the case number 2. So what is the case number 2? In this, the objective is to find out or assess patient satisfaction in hospital. So the patients who come to the hospital, how are they satisfied with the hospital administration in terms of giving them the care, right? That's the objective with which you're going to conduct the study. So what is the method? You are systematically taking the sample of 1000 discharged patients. So the moment the patients are discharged, you are going to ask them. So how are you getting the outcomes? The outcome is that 80% or 85% for that matter are satisfied with the care provided by the hospital. Isn't it a great way to look at the patient care and they are satisfied? So the conclusion from this study is that there is also a way to improve. How are the hospitals able to improve their services? They're able to improve their services largely through this data collection and survey method. That's the one. I hope that these 2 case studies must have actually solved lots of problems or must have given you some good thought. Let us look at the entire flow chart of the research. The flow chart of the research is very simple. It starts with problem identification, then it leads to hypothesis formulation, then the study is being designed, that is, how are you going to collect the data, what is the sampling frame, and then comes the data collection method, and then the data analysis and the results part. And the last is the conclusion and the report writing. So if you seriously follow the step-by-step flow chart, you are in a position to understand research better. Let us concentrate and focus on the idea of identifying the research problem, which is a core to any research. What is that? What is the research problem? A research problem is nothing but a specific issue. The specific issue, sometimes it's so difficult, sometimes it's complex, sometimes there is also a contradiction between or among different types of medicines, or it could be just a knowledge gap that the researcher wanted to address. That is what is called the identification of a research problem. For example, why do diabetes patients in North India, for that matter, or any region, why do diabetes patients in North India have poor glycemic control despite standard treatment? Isn't it a fascinating research question? You would like to know, in some region diabetes is basically more, and in some region diabetes is less, and their glycemic control is not being done properly despite the standard treatment that they are getting. And so a well-defined research problem is very, very critical for the success of the research. So if you want to really understand research, you should start with the identification of the research problem. So what is the importance of a good research problem? Well, there are plenty of them. For example, if you look at, a good and focused research problem will certainly going to give you specific objectives. And for that matter, it will also going to save a lot of time, because if you're not so sure about the problem, then you may keep hopping on other areas, which is not a good sign, and hence it also takes away a lot of researchers' time. So a good research problem will just save the time and also going to save the cost. So vague questions will not going to come handy in this, isn't it? So look at the example. Why is diabetes bad versus the proper problem is what socio-economic factors contribute to poor diabetes control in rural patients. So the first question, that was why diabetes is bad, is a very generic question, whereas the second question about the socio-economic factors contributing to poor diabetes control in rural area is a very specific question. Hence the importance of research problem is very clear. Now comes the area of literature review. Literature review is basically building the knowledge databases, and the knowledge databases gets enhanced when you have previous knowledge, published sources. A systematic review or survey of the existing body of knowledge is very much needed. For example, that if you are trying to review the past studies on diabetes treatment and the methods to identify the gaps, how are you going to identify the gaps? What has been done in the past and what are you doing in the present or the current or in the future? And this is where literature review plays an important role. So it also helps you to prevent duplication, because what has already been done, why do you want to do it? It is no reinvention of the wheel, as we call it. So reinvention of the wheel is not a real research question, and hence it prevents the whole duplication of research. Perhaps it can also enhances the research question. So you can always take the help of a lot of tools, right from Google Scholar to publish medical journals you can also go and visit the libraries where lots of journals and articles are published and kept there. So do take time to go and check in your hospital or in your library that what are the published sources. Let us now focus on the hypothesis formulation. Hypothesis formulation is nothing but an educated guess in the layman's term. When we say hypothesis, it is nothing but a testable statement. Testable statement predicting a relationship between variables. For example, in terms of diabetes patient, adherence to the structured diet reduces the HbA1c more than standard care. That is the hypothesis, or that is the statement that you have. Now, there is also the question of alternative hypothesis and null hypothesis. The null hypothesis in this case is that no effect of structured diet on HbA1c, as simple as that. So as a researcher, you're going to formulate both the hypothesis which is alternative hypothesis, and the null hypothesis. It is represented by HO, right? Now what are the different kinds of hypothesis? There are three different kinds of hypothesis. The first one is called descriptive hypothesis. As the name suggests, descriptive hypothesis is nothing but has the characteristics to describe the statement. For example, 50% of diabetes patients lack awareness. Isn't it a good descriptive hypothesis? It is indeed. Then comes the second one. The second one is a relational hypothesis. This will give you the relationship between variables. For example, exercise is positively associated with lower blood levels or the lower glucose levels. So if someone is doing lots of exercises, then their glucose level will come down. So there is a relationship between exercise and the glucose level, that you can see it. This is the example of a relationship hypothesis. The last one is a causal hypothesis. What is a causal hypothesis? Causality or cause and effect relationship is a causal hypothesis. For example, poor medication adherence leads to increased hospitalization. If you do not follow the medication properly, probably you end up in the hospitals. People who are getting or falling sick will be more likely to be seen in the hospitals. Don't you see lots of patients? I think that is a result of it. Let us look at the experimental research design and try to understand it. So what is an experimental research design? An experimental research design is basically where the researcher tries to manipulate the variables, because the variables are easily manipulated in this setting. This is where he is experimenting. So there is also control group, and then there is this experimented group. That's where the researcher plays an important role in controlling one group and trying to understand the other groups. For example, you have clinical trial where one group receives new drug and the other receives standard drug. So in this case, the control group and the experimented group will be seen differently. This is where you can control a lot of understanding of the different kinds of drugs. Whether the standard drug is actually impacting the health of the patient or the new drug that is being introduced into it. Like that is the gold cause for the standard causation. And what are the important elements in the experimental design? One is the randomization, the other one is the control group that I was trying to tell you, and then that is the last one is nothing but the blinding. So these are the elements that you have to keep in mind. Opposite to the experimental research design, you have the observational research design. What is an observational research design? This is quite opposite. There is no manipulation by the researcher in this case. And hence, look at the example. Studying association between smoking and lung cancer in patients. So you're trying to observe the behavior. So there are different kinds of observational research, like you have cross-sectional. At one point in time, you collect the data from people who are smoking. The other one is cohort. You will also follow it up over a period of time. If you follow it, could be longitudinal in nature. The other one being the case control. You will try to compare what has happened in the past and what is happening in the current. And that is where there is this retrospective comparison. Let us look at sampling. Sampling is nothing but, a subset of the population. Is the sample represent the true population? So the purpose of sample is very simple. It has to be feasible, it has to be cost effective, and at the same time, it should save the time, cost and time. For example, surveying 500 diabetic patients out of 50,000 in the region. Although your population is 50,000, but you can't test because of the time and effort. That's why sample is very important. Two kinds of sampling. One is probability and the other one is non-probability. You have stratified, random sampling, cluster sampling, and systematic sampling. Whereas non-probability, you will have convenience, judgment, and slow ball sampling. Data collection is quite important. So you may collect it through primary data, secondary data. Primary data, basically question or questionnaires, interviews, observations, all these. Secondary data, published sources like medical records and other cited studies and so on. Like you would like to see the structured interview to collect patient lifestyle data, which is a primary thing. We also analyze the data through quantitative and qualitative purposes. So quantitative, you may have to use the descriptive statistics, inferential statistics. Like in descriptive statistics, you have mean, standard deviation, median, and so on. Whereas inferential, you will use t-test, chi-square, regression analysis. So comparing the diabetes between two patient groups is basically a quantitative method. Qualitative method comes through thematic analysis, content analysis. For example, you're trying to look into the interview transcripts coded theme on patient satisfaction. You'll try to explore these data. Reporting is an important part. What you actually discovered through the research, you have to report back. So there are few important sections like introduction, methods, results, discussion, conclusion. For example, reporting that 80% of the surveyed patients were unaware of medical side effects. This is the greatest discovery through the research that you get it. We have to also be careful about the unethical practices in the research, and hence it's important to have the ethical consideration. You should always take the consent of the patients and tell them about the risk and benefits. You should always protect the identity of the patients. The data confidentiality is so important. And then the transparency, honesty of the reporting is to be listed. So there are limitations to the research, like you may have sampling biases. You may also come across the measurement issues or errors and confounding factors. For example, no response bias in patient survey can also be seen. So what is the future of the research? The future of the research now lies in the hands of artificial intelligence and big data analytics. More and more hospitals are adopting to AI. Then there is also this personalized medicine. Individuals differ from each other, hence the personalized medicine. Then the real-time data collection. We now got lots of wearables. If you see it, people are not wearing watches, but they are wearing wearables. And this will give you how many steps that you have walked, what is your glycemic index. All this is generated at the real time while you're doing it. So overall, what did we learn in this session? We learned a lot about research. Research actually turns curiosity into systemic knowledge, and it is also essential in advancing the healthcare or any other field. And ethics is very critical as far as to protect the patients and their privacy. And finally, data analysis supports evidence-based practices. Without evidence, it would be really difficult to prove any phenomena or event. With that, we come to the end of this introduction to research. Hope you had a great time watching this lesson. We wish to see you very soon. Until then, it's goodbye from all of us from Dr. B.R. Ambedkar Open University.